Anyway, let's turn our attention to what happened yesterday, because as I'm sure if you were watching any television, you were seeing all of these very, very moving accounts of the COVID Day of Reflection. I don't know why it's the 9th of March and not the 23rd of March, as we mark 5 years of COVID. COVID didn't start on the 9th of March. Lockdown didn't start on the 9th of March. I don't know why they've chosen that date, but that date they have indeed chosen. It was, though, around the time when policy changed, so that it was, let's face it, COVID policy that did a lot more damage than COVID. Now, I'm not someone who is going to make the claims of the conspiracy theorists online that COVID wasn't real and it was all cooked up and it was all a big conspiracy. I had COVID before we went into lockdown in March 2020, and I was very, very, very ill with it indeed. I know people who've been hospitalised with it. I take it very seriously. However, I still don't think that the COVID policy we had was the right thing. But what amazed me in that day of reflection, at no point did anyone reflect on whether or not the biggest damage was done by COVID, or was the biggest damage done by COVID policy? Well, let's talk about this with a man who likes his facts. Carl Heneghan, Professor of Evidence-Based Medicine at the University of Oxford. Very good morning to you, Carl.
Good morning, Julia.
I have to say, I looked at social media, I looked at some of the mainstream media yesterday, and I went, yeah, this isn't for me today, and turned it all off yesterday because it was so infuriating. On one side, people who were sort of going, oh, and it was terrible because someone's 87-year-old grandmother died. Yes, I'm sorry, this is terrible, but nevertheless, people died of things other than COVID. And at the same time, ignoring the damage to children, to our social cohesion, to our economy, and all of that. On the other side, people going, I never wore a mask, I never got a jab, it's all a conspiracy. I mean, madness, it seems to me, on both sides. What did you make of it?
Well, look, I think first is to say anybody who's lost a loved one, a family member, will always be grieving and see that as an important issue.
But people during COVID, people did die of other things than COVID.
Correct. I've been working this weekend in urgent care. I've been going to people who are end of life. I've verified deaths, 11,600 deaths in the previous week in the recorded. So that's the issue. But the fact that we are focusing in on COVID and not saying and asking questions about getting to the truth is what bothers me. Yeah. People throw out this number, 227,000 deaths, and they don't even bother to say, when is somebody going to do an investigation? I'll tell you what, me and my team are ready to start asking serious questions. What did these people die of? Yeah. How many were preventable? What really happened in care homes? What are the issues?
But again, like, did they die with COVID or of COVID? Because we know that the comparisons of the death figures for different countries almost impossible when it comes to COVID deaths, because they were all recorded on a different basis.
And out of them, ONS reports about 16,000 people died in the period with COVID on their death certificate who had no underlying causes of other diseases. Remembering some of those are in care homes who just had COVID on their death certificate. Yeah. So I think what's happening over the pond, there are many issues, what we're seeing in America, but at least they're starting to question the narrative and go, when are we going to get to the truth? Yeah. What's happening here is everybody was part of that pandemic. The only person who's left standing is the chief medical officer, and we hear very little from him. Everybody else has gone. Nobody's been accountable. Yeah. And you know what? They all seem to have done very well out of this.
Don't they just? Lots of knighthoods and the like doing the rounds. But it's interesting, we've had the COVID inquiry, and again, we know the COVID inquiry is just going to conclude that we should have just locked down earlier. Even some people who just, you know, John Edmonds and others who are like, oh, that's what we should have done, who actually campaigned against lockdown earlier. Now, I didn't want us to lock down, but when we were told by the chief medical officer, the chief scientific advisor, alongside Boris Johnson, that their concern now was that the health service would collapse and people would die unnecessarily, we need to lock down, flatten the sombrero, remember, flatten the curve for 3 weeks. I was in favour of it. Knew it would be longer than 3 weeks, but we were going to get our healthcare together. We were going to basically spread out the deaths to save more lives. I thought they must have good information. They opposed lockdown to that point very sensibly, going with established pandemic policy. I thought they were sensible. And now I know that it was all just on a whim, and it was on mad, utterly mad Imperial College computer predictions, all of which had been wrong in the past, and that pretty much every decision about our lives that was made, whether it was the 2 meters distance, whether it was wearing masks, not wearing masks, whether you could go to work, not go to work, whether you could go and socialise or not, whether you could see your parents, whether you could meet in a group of 6, travel on holiday, virtually every single one of the children at school, rather crucially, every single one of those decisions was made on a whim with no medical, scientific, evidence-based to it whatsoever. And I am still amazed by 2 things. 1, that people are not more angry about that. And 2, how so few people are aware of that?
So, look, I think you're totally right here, Julia. Let's talk about the inquiries going on. We've got this issue at the moment looking at the procurement of PPE. It's very hard to understand exactly how much we spent, but looking at the Public Accounts Committee in 2020 alone, it looks like we spent 12 billion on PPE. And 75% of that either was thrown in the bin or was in pure profits. Well, imagine saying to people, we're about to spend 12 billion and 9 billion of that's going to go in the bin. It's insane what actually when you start to put them numbers in. Talk about the schools and lockdown. At one point, 70% of the world's student population was off school. 990 countries locked down schools for more than 2 months. And we look here and think, actually, we're just going to have a nice little memorial. And I turn the news off because I am outraged by the expenditure. There seems to be problems here in the middleman, some dark forces at work. For instance, I'd be asking a question. Why don't we have a PPE factory located somewhere, deprived part of the world, that can increase or decrease its capacity and pay a reasonable price for this stuff, irrespective of whether it works or not? We could have saved tens of billions if we onshore this. What about Ed Miliband, where he's going about his net zero, sending this around the world? So you're right to seriously ask questions here, and we're right, we should be morally outraged and ask real questions about who profits and what were the forces.
Well, absolutely. But again, what amazes me is how few MPs did their job. And there were some amazing MPs who really did work, and how few of the mainstream media and an awful lot of the journalists who were doing this hand-wringing by the memorial yesterday and speaking in, in very dark tones and things. If they'd done their job properly, and I'm talking about a lot of people who were friends and colleagues of mine when I used to work in the House of Commons, just simply did not ask the right questions and don't want to ask the right questions now, because it exposes just how bad. When the biggest story of their lifetime hit, they basically went, oh, well, I'm just going to go and sit at home for a bit and then make myself feel terribly self-important. And the main thing is, we were the only broadcaster in this country here at Talk, the only one that was questioning any of this. And I didn't question it. I didn't question it in the early weeks of the first lockdown. And it was people like Brendan O'Neill and Toby Young, and I had on as guests who questioned it. I'm coming across people like you and Sunetra Gupta and others, and looking into it. I've got no scientific training whatsoever, not maths trained and things. But it was obvious to me as soon as you looked at some of the figures that there was no evidence for what they were doing, and that they carried on. And we saw from certainly the WhatsApps, Matt Hancock's WhatsApps, that were just brilliantly, heroically exposed by my colleague Isabel Oakeshott, just how unbelievably poor the decision-making process was in government, and the whim that we don't want to give Nicola Sturgeon a good point boost, so we're going to put kids in for 8 hours into masks in our schools in England too. I just find it extraordinary that people are not absolutely outraged by this and demanding, frankly. Again, I'm never going to forgive, I'm never going to forget, but I don't just want a proper inquiry. I genuinely think there should be criminal prosecutions of some people, because I think what they did was so wrong. The damage to our economy, the damage to our children, to their education, to our civil liberties, to our health. People died as a result of closing down our NHS, that people have not actually had to be punished for that.
And the thanks you got for it is, Julia, we share that the government was surveilling you and looking at what you said and following you up, and in doing so, trying to report and mitigate what was going on. Look, I think it's incredibly important. We will start to look at politics and policy when people reflect uncertainty more and start asking more questions and answers. And once they do that, we should start with, I think we should stop the inquiry right now. It's going to cost in excess of £200 million. To be shut down, money's tight, and we should repurpose that money and say, look, let's go and find out what actually happened.
Absolutely. Oh, I'd love them to do that. Carl Heneghan, always so good to talk to you. You've been an absolute hero throughout this. And